Okay, let's dive in. Saw palmetto keeps popping up everywhere. It's actually one of the top-selling dietary supplements out there.
It really is. You hear about it a lot, especially for men's health.
Right, and the numbers are pretty surprising. Something like, what, more than a third of U.S. adults taking supplements are using saw palmetto, mostly for prostate health, supposedly.
That's the main association, yeah.
But here's the twist. I was reading this piece, and experts from Harvard, no less, are saying maybe pump the brakes. They're suggesting men should be, pretty skeptical about those benefits for the prostate.
Yeah, that skepticism is definitely out there in the scientific community.
So that's our mission for this deep dive, really. Let's try and unpack what saw palmetto is claimed to do, and importantly, why these experts are urging caution. Sound good?
Sounds perfect. So the primary claim, the one you see kind of marketed everywhere, is that it helps with symptoms of BPH.
BPH, that's the enlarged prostate thing, right?
Yeah.
But not cancer.
Yeah. Exactly. Benign prostatic hyperplasia. And the symptoms are, well, they can be really bothersome. Things like having to pee really often, especially at night.
Yeah.
Trouble getting the stream started, or a stops and starts, maybe a weak flow. You can see why men would look for anything to help with that.
Oh, absolutely. That stuff directly impacts your day-to-day, your sleep. So, okay, that's the appeal. But where does the Harvard skepticism, the expert caution, come from? What's the basis?
Well, it really boils down to the science, or maybe the lack of consistent science. Fascinating, actually.
How so?
There have been quite a few studies looking at saw palmetto for BPH symptoms. But the results, they're honestly all over the place.
Ah, okay. Not clear-cut then.
Not at all. You've got some usually smaller, perhaps less rigorous studies that hint at maybe some mild improvement in symptoms.
Okay, a little bit of hope there, maybe.
Perhaps. But then you look at the bigger, more robust trials, the kind of gold standard studies, including some funded by the National Institutes of Health, the NIH.
Right, the big guns.
Exactly. And those studies have generally failed to show any significant difference between saw palmetto and a placebo.
A placebo, so like a sugar pill.
Pretty much. No real difference in improving those urinary symptoms we talked about, or even in measurably shrinking the prostate itself.
Wow, okay. So, despite being so widely used, the really solid scientific evidence just isn't quite there. Is that fair?
That's a very fair summary. That's the core issue. This disconnect between its massive popularity and the lack of consistent, high-quality evidence saying it actually works better than nothing. Now, that's not to say no one ever feels better taking it. Some individuals might report improvement.
Could that be the placebo effect, though?
That's certainly a possibility, yeah. The placebo effect can be quite powerful, especially for subjective symptoms like discomfort or urinary frequency. But looking at the objective data across large groups, the specific effect of saw palmetto itself seems minimal, if anything.
Okay, so if the major studies aren't showing a clear benefit, why is it still flying off the shelves? What's driving this continued popularity for you, the listener? Is it just like the natural is better idea, or maybe avoiding prescription meds?
I think those are almost certainly huge factors.
Yeah.
There's definitely a strong cultural current that natural equals safer or gentler, even if the proof of effectiveness isn't there.
Right, people trust plants sometimes more than pharmaceuticals.
That seems to be part of it.
Okay.
Also, talking about prostate problems can be, well, uncomfortable for some men. They might be hesitant to bring it up with their doctor.
Yeah, I can see that.
So grabbing something over the counter like saw palmetto feels like an easier first step. And let's be honest, supplement marketing can be incredibly persuasive.
True. So for you listening, it really boils down to this tension. Huge popularity, lots of anecdotal stories maybe, versus this consistent caution from scientific experts based on the lack of strong data.
Precisely. And if you zoom out a bit, this whole saw palmetto situation is kind of a case study, isn't it? It really highlights why it's so important to look critically at health claims, particularly for supplements. Because
they aren't regulated the same way as drugs.
Right, exactly. Just because something is natural and widely available doesn't automatically mean it's effective for the specific health issue you're trying to address.
So, the takeaway for you, our listener, when you see ads or hear about remedies like saw palmetto, is maybe dig a little deeper. Look past the hype.
Definitely. Consider the source of the claims. Were the studies large, well-designed? Have the results been replicated by different researchers? These are the kind of questions to ask.
It makes you think, though.
It really does. And it raises a final sort of provocative question for everyone listening. Given this persistent popularity, despite the scientific skepticism, what other factors, maybe cultural, psychological, economic, do you think keep driving the widespread use